All right, so good evening, everyone, and welcome to our short webinar on trends in the MedTech licensure exam. So during this webinar, we'll be discussing some questions asked in the last board exam. Now, these are not exact questions. No? These are based on the feedback of our students. At least yung idea, mapag-usapan natin. And magkaroon din kayo ng idea kung paano ba yung mga tanungan in the recent boards. Okay? So let me introduce myself. I am Dr. Gabriel Paul Pascual. You can call me Doc Gab. I am the founder and CEO of Legend Review Center. I placed second in the March 2021 Physician Licensure Exam and also second in the September 2014 MedTech Licensure Exam. So medyo favorite number natin yung number 2. Ayan. I graduated Doctor of Medicine at FU and RMF as cum laude. And of course, my pre-med was Bachelor in Medical Laboratory Science at St. Louis University, where I graduated as magna cum laude. Okay? So ito po yung scores in the pretest. The highest score was 29. No? Walang tumama ng 30. Sayang, 1 point. Okay? Average score was around 17, no? 16.94. No? Okay? So let's start off with clinical chemistry. All right. So in the last board exam, clinical chemistry was relatively easy, no, compared to the other subjects. Okay? So ang feedback ng students natin, most of the questions answerable naman and na-discuss naman during the review. Okay? And mahilig pa rin sila mangopya, no, mag-copy-paste ng questions from your Q&A books, like for example, HAR. And Elsevier din. No? Make sure that you read this Q&A books, no? Yung si HAR at saka si Elsevier. Alright. So first question. Which Westgard rule is considered only as a warning rule and would not result in the rejection of a run? So sino daw yung nag-iisang Westgard rule na considered the warning rule? So this is your 1-2S. 75.8% of the students answered this correctly. So that's good, no? Majority of the takers answered this correctly. So these are your Westgard rules. Kabisado na ba to, guys? Usually in the board exams, mga 2 to 3 questions po ito. Okay, so ano yung mga natatanong dito? Natatanong of course yung description ng bawat Westgard rule. Make sure kabisado yung description nila. And of course, in the last board exam, actually last 2 board exams, nag-start na sila magsama ng pictures in the questions, no? So dapat pag pinsitaan kayo ng Westgard rule violation, ma-identify din sila. Okay, so later on we will discuss that. You also need to know the types of error being detected by these various Westgard rules. Okay, so some of these rules would detect random errors. Some of them would detect systematic errors. Ang mnemonics natin dito, kapag nagsa-start po sa even number, so let's say 22S, 41S, and 10X, pag nagsa-start po sa even number, yung Westgard rule, it detects systematic error. Okay? Again, pag nagsa-start sa even, systematic error po yung dinedetect. All the rest, they detect random errors. Okay? So isa rin paboritong natatanong yan sa board exam. Alright? And then, pansin nyo rin itong last column natin dito sa comments. Okay? As you can see, most of the rules are called rejection rules. So pag lumabas ito during your quality control, you would have to reject the entire run. Kaya nga tinawag na rejection rule. Nag-iisa lang po ang warning rule. No? The only warning rule is 1-2S. So meaning, pag na-violate po ang 1-2S, okay, not necessarily magre-reject ka na. You just need to investigate, no? You just need to check kung meron ba nagiging problem na dun sa ating methodology, no? Possibly, baka yung reagent, baka yung instrument, and so on. Mag-investigate ka lang, but not necessarily you're going to reject yung ating entire run. Okay, so are we clear with that? Now, let's take a look at your various Westgard rules. Try to identify this one. Ano kaya yung Westgard rule na na-violate po dito? Last boards, may mga pictures po ng LJ chart. So hindi malayo. In the next board exam, dumami pa ito. Ano pong Westgard rule ang na-violate dito? We have one control value exceeding your plus 2S. Type nga ako sa chat box, guys. So very basic. This is your 1-2S violation. Ayan. So you only have one control value exceeding 2S. And again, do not forget, this is your warning rule. Okay. Oh, no, lumabas yung sagot. How about this one? Ano po ito? You have one control exceeding your minus 3S. No? You're exceeding the 3S line. Okay, so this is your 1-3S violation. Ang 1-3S po, again, rejection rule na po ito. How about this one? You have two consecutive controls exceeding 2S on the same side of the mean. So what is this violation? Okay, very good. This is your 2-2S. Okay, so kung may dalawa pong consecutive controls exceeding 2S, that is 2-2S. How about this one? Again, you have two consecutive controls exceeding 2S, but this time, they are on the opposite sides. Anong violation po ito? Okay, very good. This is your R4S. So pag may nakita kayong dalawang consecutive, okay, dalawa na lang iisipin nyo guys. Either 2-2S or R4S. If they are on the same side, that is your 2-2S. If they are on the opposite sides, that would be your R4S. How about this one? You have four consecutive controls exceeding 1S on the same side of the mean. What is this violation? Sagot lang po ng sagot. And so this is your 4-1S violation. No? 4-1S violation. And then lastly, ito very, pagkakita mo pa lang, alam mo na ito yun. You have 10 consecutive controls found on one side of the mean. Okay, very good. This is your 10x violation. So again, make sure that you know how to identify these Westgard rules. No? Kasi nga may mga pictures na po tayo sa board exam. Kahit black and white to guys. No? Kahit black and white ito, dapat masagot natin. No? Hindi necessary yung mga colors na yan. Alright, so let's move on to the next question. Yan. So what type of errors observed from days 10 to 16 in this control chart? So this is your control chart. Zoom lang natin. Yan. So ano daw yung nakikita natin na type of error from days 10 to 16? So as you can see, you have here consecutive controls, no? Ilan sila? 1, 2, 3, 4. You have 7 consecutive controls, okay? Decreasing, no? Consecutively decreasing. So this is your trend. Okay? So again, majority of the students got this correctly. So how do you define your trend? Your trend is defined as control values increasing or decreasing for 6 consecutive runs. Okay, magkakasunod-sunod sila na pataas ng pataas or pababa ng pababa. Ang isa pang paboritong tinatanong dito is the main cause. Sino po ang nakakaalam ng main cause ng trend? Alright, so very good. The main cause would be deterioration of reagents. Pakitandaan po, main cause ng trend, deterioration of reagents. Now, another error is your shift. Your shift is defined as 6 consecutive control values on the same side of the mean. So, 6 na magkakasunod-sunod and they're all found on the same side of the mean. And what is the main cause of your shift? Okay, very good. The main cause of your shift would be improper calibration. Okay, improper calibration. And then, another error would be your outlier. No, outliers are highly deviating values. Sobrang layo nila from the rest. Okay? These are control results outside established limits. Again, outliers are highly deviating values. Okay, next. Ito, marami nagkamali, guys. The patient sample is assayed for fasting triglycerides and a triglyceride value of 1,036 milligrams per deciliter was measured. This value is of immediate concern because of its association with which of the following conditions. By the way, this question was lifted from Elsevier. Ayan. As in copy-pasted siya from Elsevier. Marami pong sumagot ng coronary heart disease, but the answer here is pancreatitis. Yung mga patients po natin with very, very high triglyceride levels, they are at risk of having pancreatitis. So, kami po, binabantayan namin yan, no? Usually, pag lumagpas na ng 500 milligrams per deciliter, na 500, pag lumagpas na yung triglyceride ng 500, yung patient natin at risk na ng pancreatitis. So it becomes an immediate concern for us as physicians. And what we do is, of course, we lower that. Otherwise, yung patient natin, baka the following day, no, or baka immediately magkaroon na ng pancreatitis. Okay, hindi po siya coronary heart disease. Pancreatitis po ito. Yung very high triglyceride values. Okay? Next question. Yan. Which lipoprotein migrates farthest from the anode during electrophoresis? No? Majority got this correctly pero marami ring sumagot ng HDL. Okay, baka kasi ang pagkakaintindi nila farthest, no? Pinakamalayong imamigrate. Pero guys, tignan niyo yung pagkakatanong niya. Farthest from the anode. Pinakamalayo dito sa positive electrode nyo. So ibig sabihin, pinakamalapit sa negative. And sino yung pinakamalapit sa negative electrode? That would be your chylomicron. Okay? So ang sagot po dito is chylomicron. So remember, the arrangement of your lipoproteins in electrophoresis would be as follows. No, the most anodal, pinakamalapit sa anode, is your HDL. So this is your HDL. Okay, ano pong susunod after HDL? Anong susunod sa HDL, guys? Ang susunod po na most anodal is VLDL, followed by your LDL. And then the least anodal or yung pinakamalayo from the anode is your chylomicron. Okay, so yan yung pagkakasunod-sunod nila in your electrophoresis. Okay? And based on electrophoresis, meron ding other names yung mga major lipoproteins nyo. Ano po yung other name ng HDL? Based on electrophoresis. May nakakaalam po ba? Ayun, very good. Your HDL is also known as your alpha lipoprotein. VLDL on the other hand is known as your pre-beta lipoprotein. LDL is known as your beta lipoprotein because again, it migrates in the beta region. Okay, natanong na rin yan, no? Recall question rin yan, guys. Sino daw yung beta lipoprotein? That's your LDL. Okay? So pakikabisado po yung pagkakasunod-sunod ng ating lipoproteins on your electrophoresis. Any questions so far? Okay, next. Ito yung favorite question ng mga board takers last board exam. No? Hindi nila in-expect na yung mga ganitong tanong. And which of the following is not an alcoholic beverage? No? Thankfully, maraming nakatama sa inyo nito, guys. 84% got this correctly. Not an alcoholic beverage, that would be your root beer. No, beer ang pangalan niya, guys, pero hindi siya alcoholic, ha? Okay? Marami ring sumagot na takers ng fruit brandy. Na medyo siguro nag-overthink sila dito. Okay? Pero root beer, guys. Ang root beer nyo, actually, siniserve nga ito sa mga McDo sa mga Jollibee. No? Non-alcoholic talaga ang root beer. No? Kahit na bumili kayo mamaya ng root beer, tignan nyo yung kasama doon na ingredients. No? Wala pong alcohol yan. Okay? So, ang ano dito guys, moral lesson dito, sa board exam po, anything can be asked. No? Anything under the sun can be asked. So, be prepared. Walang kwenta na magreklamo tayo guys kasi hindi tayo yung board examiner. No? Kung anong gusto nila itanong, itatanong talaga nila. Okay? So, let's go to micro para. So, first question. Profuse watery diarrhea or what we call rice watery stools, leading to dramatic fluid loss, severe dehydration, and hypotension that frequently leads to death is the hallmark of which toxin activity. So what disease is this? Pag nakita niyo yung rice watery stool or rice watery diarrhea, what is the disease? The disease is of course cholera. Caused by what agent? Ano po yung cause ng ating cholera? Madaling tandaan, that would be your Vibrio cholerae. And of course, the toxin secreted by your Vibrio cholerae is your cholera toxin. Okay? Yung mga patients dito, ito pala, yan, yung mga patients dito that they suffer from voluminous rice watery diarrhea. As in, halos timba na yung itain nila. So ano nangyari? These patients, okay, they commonly die from dehydration. So management natin dito, of course, we will have to hydrate our patient. No, i-hydrate natin yan and of course, replace the electrolytes. Otherwise, pwedeng mamatay yung pasyente because of dehydration. Okay, so this is cholera. Again, wag niyo nakakalimutan guys. Pag nakita po yung rice watery diarrhea, this is your cholera. Next, which of the following organisms will have the following biochemical results? So last board exam, no, hindi ganun kadami yung questions about biochemical tests. Okay? Kung may tinanong man, madali lang, like this one. Okay, so indole positive, MR positive, VP negative, citrate negative, PAS neg-neg. This is your E. coli. Okay, must know po ito. Hindi kayo pwedeng pumunta sa boards na hindi ito kabisado, guys. E. coli po on your IMBIC is PAS neg-neg. How about Klebsiella and Enterobacter? Ano po ang IMVIC ng Klebsiella and Enterobacter? So as a general rule, please do not forget, Klebsiella and Enterobacter, okay, Klebsiella and Enterobacter are neg-neg, pas-pas, on IMVIC. Opposite ng E. coli. Di ba E. coli pas-pas, neg-neg. Ang Klebsiella and Enterobacter, neg-neg, pas-pas. Opposite. Okay? The exemption to the rule is Klebsiella oxytoca. Okay, please remember that Klebsiella oxytoca is the only indole positive. This is the only indole positive Klebsiella. Okay? So si Klebsiella oxytoca, pas, neg, pas-pas yan. Okay? This is the only indole positive Klebsiella. Okay? How do I remember this? No? Ang palatandaan ko dito guys yung X. Yung letter X sa oxytoca. Yung letter X, tinabingin niyo ng kaunti, mukha na siyang positive sign. And meron isang test na positive sa kanya na hindi dapat. And that's your indole. Again, this is the only indole positive Klebsiella. Okay? Ayan. So ito yung mga common IMVIC reactions. Again, E. coli is pas-pas, neg-neg. And then Klebsiella Enterobacter, neg-neg, pas-pas. Except for Klebsiella oxytoca. And then this is a summary of your key reactions for Enterobacteriaceae. Pag ito guys, nakabisado nyo, ang dami nyo ng masasagot na biochemical test na panel. Okay? Lactose negative. Okay, let's go over this one. Meron akong ibang table for this. Wag na muna yan. Dito tayo sa H2S positive. For H2S positive, ang mnemonics natin dito, okay, would be PEX. Okay, sa mga gram-neck bacilli nyo, no, ang mga H2S positive would be PEX. No? You have your Proteus, Edwardsiella, Citrobacter, and Salmonella. Okay? Isang PEX lang guys. Huwag niyo uulitin. PEX. Okay? H2S positive. For VP positive, this is your KES. Okay? Bakit siya may H? No? Wala lang dito sa table yung half niya. Dagdag niyo yung half niya guys. So yung KES group ninyo, these are the VP positive organisms. Okay? Kagandahan nito, yung VP result nyo is always opposite of MR. Are you familiar with that? Yung VP result is always opposite of the MR. So kung VP positive, alam mo na MR negative yung organisms na to. And then the other members of Enterobacteriaceae, they are MR positive and then they are VP negative. No, MR and VP are always opposite. Huwag niyo kakalimutan guys. Okay? For PD positive, ang palatandaan natin dito is PPM. Okay? And you can also add Klebsiella since Klebsiella is slow PD positive. PPM stands for Proteus, okay? Providencia, Morganella. Okay? May isa pang mnemonics dito guys, no? Medyo R-rated lang. You can remember this as PP-mo. Okay? PP-mo. Mnemonics lang po ito, no? Huwag niyo akong iti-Twitter guys. PP-mo. Okay? Proteus, Providencia, Morganella. Okay? Urease positive, you also have your Proteus, Morganella, and Providencia, although madami actually yung mga urease positive natin. And then for non-motile at 35 degrees Celsius, the mnemonics here would be sky. Okay, Shigella, Klebsiella, and Yersinia. But take note, yung sky na mnemonics, valid yan if ang incubation nyo is at 35 degrees Celsius. Kasi po si Yersinia, at 22 degrees Celsius, nagiging motile na siya. So at 22 degrees Celsius, SK na lang yan. Yung sky na yan, that's for 35 degrees Celsius. Again, these are non-motile. Alright? So you can take a screenshot of this, okay, for your reference. Okay, next question. So parasitology naman. Trophozoite forms of amoeba are found in what type of stool specimen? Okay, ito po galing din kay, I think, Elsevier. Yan. So the answer here would be watery. Okay? Bakit sa watery nakikita ang trophozoite? Bakit sa watery? Well, watery na stool, that's your diarrhea. No? In diarrhea, mabilis ang passage ng stool sa large intestine. Diba? Wala nang time na mag-reabsorb ng water, so hindi na nagda-dry yung stool. And remember, ang trigger para magkaroon ka ng encystation. Have you heard of this process? Encystation. ang mag-stimulate ng encystation is desiccation, dryness. Okay? Kapag yung stool mo na reabsorb yung water, magiging dry siya, doon ka magkakaroon ng encystation. Doon magiging cyst yung mga trophocyte nyo. In diarrhea, this does not happen. No, in diarrhea, this does not happen. Kasi nga, mabilis yung passage ng stool. So walang time na yung trough maging cyst. So what are you going to find in your watery stool? You're just going to find mostly trophocytes. Okay? So para mas maging clear sa atin ito, let's take a look at the life cycle of the histolytica. Are you familiar with this one? So mabilis ang discussion lang guys na life cycle. Okay? So ang ating infective stage for E. histolytica is the cyst. Ano mode of transmission nyo? Mode of transmission, fecal-oral. Okay? So eventually, once you ingest the cyst, in the small intestines, the cyst would undergo excistation. Excistation. So ibig sabihin excistation from cyst, magiging trophozoite. Okay? Eventually, the trophozoite would inhabit the large intestine. So ang habitat natin dito, large intestine. Dito rin mag-exert ng pathophysiology yung trophocyte nyo. Dito siya magkakos ng ulceration sa large intestine. So eventually, as the trophocyte migrates in the large intestine, ayan, yung stool ninyo mas nagiging formed because of water absorption. And eventually, kapag nagkaroon ng dryness, nagkaroon ng desiccation, you would now have the process of desiccation. So ito yung, you would now have the process of encystation. Yan, encystation. So from from trophozoite, magiging cyst na siya. Okay? So eventually, what would you see in your formed stool? What you would see in your formed stool would be the cyst. Okay? Kung hindi po ito mangyari, ano makita mo? Trophozoite. Okay, next question tayo guys. So which type of biological safety cabinet is seen in the picture below? Okay, medyo marami nagkamali dito. Ayan, so let's zoom in on the picture. Ayan. So in this picture, makita nyo guys, yung biological safety cabinet nyo, bukas sa harapan. So room air can enter. Okay? Air is only filtered before it goes out. So anong type ng cabinet yun? That's your class 1. Palatandaan natin dito guys, class 1, once lang na-filter ang hangin. And that's before going out. Okay? That's class 1. Sa class 2, twice ang filtration. Before the before the air, bakit pa nag-water? Before the air goes in and before the air goes out. So the air is filtered twice. Okay, that's class 2. Nakuha guys? Okay, medyo nagulantang lang yung students dito. Di nila in-expect na picture yung papakita. Pero kung alam niyo yung definition ng class 1, class 2, and class 3, masasagot niyo ito. Si class 1 yung tinatawag ng open front cabinet. So ito yung types ng biological safety cabinets. Again, class 1 is open front. Unsterilized room air enters. Air passes to your HEPA filter before being exhausted. So once lang ang filtration. Class 2 is your laminar flow cabinet. Twice ang filtration. Okay, before the air goes in and before the air goes out. And then class 3 is yung completely enclosed. You have negative pressure inside. Okay, that's class 3. Alright. So ito yung basic na classification. Meron din mas complicated na classification. Okay, ito guys, next time natin pag-usapan. No? I'm just showing this to you para malaman ninyo na hindi lang po ganito kasimple ang classification. And meron mas complicated pa. And sometimes natatanong din ito. No? Like for example, yung class 2B1. Yung class 2B1, 30% of the air is recirculated, 70% is exhausted. Recall question po ito. Okay, so next question. Identify the parasite whose ova is shown in the picture. Okay, so ano nakikita natin dito guys? This is your classic Japanese lantern egg. And as you can see, you have bipolar plugs. The bipolar plugs are protruding. This is your Trichuris trichura. Okay, kahit black and white to guys, masasagot nyo ito. Okay? Ayan. So make sure no na when you study parasitology, may tinitingnan din kayong atlas. No? Huwag nyo nang try imagine kung anong mga description ng mga eggs. Okay, tingnan nyo na agad yung picture. So this is your Trichuris trichura. Again, the egg is described as your Japanese lantern egg. The adults on the other hand are described as your whip. Kaya nga tinawag silang whipworm. Okay? Makita niyo yung anterior part manipis. Siya yung mukhang whip. And then the posterior part is described as robust. Mukha siyang handle ng whip. Okay? So again, this is your whipworm. And this is the life cycle. So ang mode of transmission po natin dito is fecal-oral. Ano po ang ating infective stage? Alright, so that would be the ova. Pero careful kayo. Okay, it should be the embryonated ova. Okay, embryonated ova. So the embryonated ova would hatch in your intestines. Eventually, after hatching, it would migrate to your large intestine and magiging adult na siya doon. And anong gagawin ng adult nyo? The adult would start laying eggs. And this eggs would be passed out in the stool. So what's your specimen? Your specimen would be stool. And what's your diagnostic stage? Type nga ako sa chat box, guys. Anong diagnostic stage po natin? Anong makita nyo sa stool? Alright, so makita natin sa stool is again your ova or your egg. But this time, the unembryonated ova, immature pa na ova. Okay? Can this infect humans? Pag nakain mo yung unembryonated ova, may infect ka ba? Remember, sabi natin kanina, the infective stage is your embryonated ova. So yung unembryonated then, that's still non-infectious. Kailangan mapunta muna siya sa soil for it to mature and eventually become embryonated. And after that, magiging infective na siya. Kaya nga po ang trichuris considered siya as one of your soil-transmitted helminths. Okay? Important ang soil sa life cycle niya. Question, guys. Aside from trichuris trichura, what are the other soil-transmitted helminths? Ito din yung tinatawag nating unholy trinity. Okay, so good. Ascaris. Aside from Ascaris, yan, hookworm. So ang mnemonics natin dito, guys, HAT, H-A-T, HAT. Hookworms, Ascaris, trichuris. Lahat sila important ang soil for their life cycle. Okay? Clear tayo dito, guys, ha? Iba yung ash. Iba yung ash. Iba yung ash. Yung ash po, those are the helminths that undergo part-to-lang migration. Sige, sulat ko na rin, ha? So yung mga soil-transmitted, this is your HAT. Yung ash naman, those are the parasites that undergo heart-to-lung migration. Okay? Ash stands for Ascaris. Okay, Ascaris lumbricoides. And then you have your Strongyloides stercoralis. And then hookworms. Okay, wag niyo ko confuse, guys, ha? Ayan. So yung trichuris niya, soil transmitted siya, pero hindi siya kasama dun sa ash. Hindi siya nag-undergo ng heart-to-lung migration. Okay? Again, you can take a screenshot of this para madagdag niyo sa mnemonics niyo. So next, let's go to clinical microscopy. So clinical microscopy, okay, medyo basic yung questions, and a lot of the questions were actually lifted from Strassinger. So make sure that you read yung end of chapter questions si Strassinger. Kumukuha po sila doon. Okay? So first question, identify the uric crystals shown in the picture below. So itong picture na to, sabi ng students, ito yung lumbas. Okay? So what are these? These are your hippuric acid crystals. Okay, hippuric acid crystals. Okay? So ang ano dito, main point dito, guys, when you study clinical microscopy, particularly urinalysis, make sure that you also study the pictures. No? Tignan niyo yung itsura ng mga abnormal RBCs, abnormal WBCs, yung mga cast niyo, and then of course the crystals. Okay? Madaling isama yung mga pictures na mga yan sa board exam. Okay? Next. Differentiation among RBCs, yeast, and oil droplets may be accomplished by all of the following except. The answer here is lysis of yeast cells by acetic acid. Ang nilalize po natin with acetic acid would be RBCs. No? Kung gusto mong malaman kung RBC ba yung nakita mo, you add acetic acid and that would be lysed. Yung yeast cells po, they are not lysed by acetic acid. Okay? Next, fire hazard grading. So this question is actually pertaining to your NFPA symbol. Okay, familiar ba kayo dun sa NFPA symbol? So in the NFPA symbol, yung fire hazard nyo is graded from 0 to 4. Okay, ito po yun. So as you can see, yung red na diamond, that's your fire hazard. Ang grading po is from 0 to 4. Eh dati tinatanong yung ibig sabihin ng mga grading na yan. So ano ibig sabihin ng 1, for example, sa fire hazard? O, ganun yung tanungan before. But thankfully, in the last board exam, ganito lang siya tinanong. Okay? So make sure no, kabisado niyo yung symbol na to, guys. Alright. And since kung itatanong man to black and white, make sure alam niyo yung placement. Okay, make sure alam niyo yung placement. Yung top diamond nyo, that's your red, yung fire hazard. Yellow, yung nandito sa right, that's your instability hazard. Specific hazard, yung nandito sa baba na diamond. And then dito sa left side, you have your health hazard. Okay, so lahat naman sila 0 to 4, no? Except for your specific hazard. Okay, next. Ito very easy. A urine volume of less than 400 ml per day in adults is termed as, this is your oliguria. Okay? From the prefix oligo. Oligo means few. No? So, kaunti lang yung ihi, pero not totally wala. So, less than 400 ml yan per day in adults. Okay? Next, which of the following is the characteristic appearance of WBCs observed in hypotonic urine? So, ano daw ang itsura ng WBCs in hypotonic urine? This would be your glitter cell. All the others, no, all the other choices here would pertain to abnormal forms of RBCs. Yung crenated na RBC, saan nyo nakikita? Hypotonic or hypertonic? Type nga sa chat box, guys. Ito, paborito ring tinatanong sa ASCP. Ang crenated na RBC po, tonic or hyper? Okay, very good. This is seen in hypertonic urine. Okay? Those cells, on the other hand, more of hypotonic. How about yung dysmorphic? Saan nyo nakikita yung dysmorphic? Where do you see dysmorphic RBCs? Ang dysmorphic, glomerular damage. Okay, sa mga glomerulonephritis. Okay. Next, let's go to hematology. So hematology in the last boards was also quite easy. Okay, answerable naman yung questions, and a lot of the questions were also lifted from Q&A books. Like for example, sina Har, sina Elsevier, and sina Shula. And also Turgeon. Ayan, si Turgeon, guys, yung mga end of chapter questions, no, tinanong din. Nag-lift din sila doon. Okay? Hindi na siya, dati Rodax, mahilig sila kay Rodax. Ngayon, ang favorite na nila sa Hima si Turgeon. Okay? So first question, which growth factor is produced by the kidneys and is used to treat anemia associated with kidney disease? This is your erythropoietin. Remember, erythropoietin is the hormone which stimulates RBC production. And 90% of erythropoietin is actually produced by our kidneys. So kaya nga yung mga patients na may CKD, familiar ba kayo sa CKD? Yung mga patients with CKD, chronic kidney disease, a lot of them develop anemia, especially in the severe stages. Okay? So makita niyo yung mga CKD patients, yung mga nagda-dialysis, binibigyan din natin ng erythropoietin. Otherwise, they would go into anemia. Okay? So again, no, erythropoietin ang sagot po dito. Alright? Next, what clotting factors are inhibited by protein S? Okay? So thankfully, marami nakasagot ng tama dito. This would be your 5A and 8A. So let's take a look at the function of protein S. Okay? So sina protein S, okay, dito sila nagiging bida. No? In your coagulation pathways, of course, you activate prothrombin to thrombin. Yung thrombin or factor 2A, together with thrombomodulin, it activates protein C and protein S. And anong gagawin ng protein C and protein S? Or in particular, activated protein C. Your activated protein C would inhibit 5A and 8A. So this acts as an anticoagulant. Para mas maintindihan natin, guys, we have here another picture. Oops. Ayan. So yung thrombin coming from your coagulation pathways, ayan, together with thrombomodulin, it would activate protein C into activated protein C. Yung protein S, siya yung cofactor ng protein C. Okay, and this activated protein C would inhibit 5A and 8A. Okay? So ganun nagiging anticoagulant ang protein C and protein S. They inhibit factors 5A and 8A. Okay, next, we have here a picture. No? Ito yung picture na tinanong sa hematology last boards. Ayan. So I'm sure you're familiar with this. Okay, these are your stomatocytes. Kahit black and white to guys, kahit black and white ito, ma-identify nyo sila as stomatocytes. What's the other name for stomatocytes? Okay, so these are your mouth cells. Okay? O sige nga, anong condition ang associated sa presence ng stomatocytes? Siyempre may sasagot ng hereditary stomatocytosis. Aside from that, okay, very good. That would be your Rh null phenotype. No, yung Rh null associated with your stomatocytes. May mnemonics ako dito guys, no? Pero kailangan ng imagination. So this is how I remember this. Okay, baka lang naman makatulong. So i-spell niyo yung null. This is letter N. O, titigan niyo mabuti guys ha. Letter N, letter U, letter L, letter L. Tapos bilugan nyo guys. O, ano nabuo natin? O, you have your stomatocyte. Nagets nyo yung mnemonics? So N, U, L, L. And then bilugan nyo. That's your stomatocyte. Rh null disease. Okay? Ayos ba? Buong gabi ko pinag-isipan yan guys. Okay. So make sure that you look at the pictures of your abnormal RBCs. Ha? Madaling itanong yan sa board exam. Nung last boards, I think target cell naman yung lumabas po. Target cell naman yung lumabas. Yun din, madaling identify, di ba? Okay, next. Neither the APTT nor the PT detects a deficiency of, obviously this is your platelet factor 3. Remember, the APTT is sensitive. Ang APTT nyo, sensitive yan to deficiencies of the intrinsic pathway and the common pathway. Ang PT naman po, sensitive yan to deficiencies of the extrinsic pathway and the common pathway. Okay? Hindi nila madedetect ang deficiencies ng platelet factor 3. Okay? Kung nalilito kayo dito guys, may mnemonics din tayo dito. Ang mnemonics natin dito, tandaan nyo, si X nag-PT. Nag-pregnancy test daw yan. Si X nag-PT. So ang dinedetect ng PT, ng prothrombin time, would be deficiencies of the extrinsic pathway as well as the common pathway. Okay, si X nag-PT. Ayan. And platelet aggregation would occur with the end production of your thromboxane A2. Okay, so thromboxane A2, one of its functions is platelet aggregation. Okay, and this substance is actually inhibited by aspirin. When you take aspirin, you inhibit the production of thromboxane A2. So pag nag-aspirin ka, wala kang thromboxane A2, inhibited ang anong function? What function? Platelet aggregation. So pag tinanong kayo, what function is inhibited by aspirin? Ang sagot po doon, platelet aggregation. Okay, ito rin yung reason kung bakit yung mga patients na nag-take ng aspirin, you cannot use their platelets for donation. Okay, kasi yung platelets nila, no, hindi mag-aggregate yan. Alright. So next, ISBB po tayo. And all of the following are routinely performed on your cord blood sample except this is your antibody screen. Okay, ano ba yung source ng cord blood? Yung cord blood nyo, of course, from the fetus yan. And remember, yung mga fetus, yung mga neonates nyo, they still do not produce antibodies. So it would be useless to do your antibody screen. Kaya nga po sa ABO typing, ano lang ang ginagawa natin sa mga newborns? Forward or reverse typing? Sa newborns, ang ginagawa lang, forward typing, antigen typing lang. You do not do your antibody typing kasi wala pa silang antibody production. Diba? You do not do your reverse typing kasi wala pang antibody production in the neonates. Okay? Ayan, maraming nakatama. Next, FFP is used to treat the following except. So, FFP is your fresh frozen plasma. Okay? Anong meron sa FFP? Actually, sa FFP, all coagulation factors are present. So, can you use this to treat DIC? Yes. No, sa DIC, yung disseminated intravascular coagulation, lahat ng coagulation factors consumed. lahat sila ubos. Okay? So can you use FFP? Yes, kasi kay FFP nandun lahat. Ma-replace mo lahat. Okay? How about the liver disease? What's the problem with liver disease? Anong problem sa liver disease? The problem is, remember, most of your coagulation factors, no, almost all coagulation factors are produced by the liver. So in liver disease, bagsak din lahat ng coagulation factors. Okay? So can we use FFP? Yes, kasi lahat na kay FFP. 'Di ba? Parang yung kanta ni Daniel Padilla, nasa iyo na ang lahat, 'di ba? Yun sa FFP, nasa kanya ng lahat. So you can use this to replace all coagulation factors. Okay? How about vitamin K deficiency? How about vitamin K deficiency? Can we use FFP to treat vitamin K deficiency? Ano bang factors ang nagiging deficient in vitamin K deficiency? Sige nga. What factors are deficient in vitamin K deficiency? Okay, this is your prothrombin group. Very good. No? Prothrombin group. Factors 2, 7, 9, and 10. Kaya bang i-provide yan ng FFP? Kaya ba? Of course. Kasi lahat nga na kay FFP. So this can also be used to treat vitamin K deficiency. Alright? How about idiopathic thrombocytopenic purpura? Ano bang problem dito, guys? Ang problem dito, platelets. Ang bumabagsak po, platelets. So may platelets ba sa FFP? Diba? This is plasma. Konti lang ang platelets dyan, guys. So we cannot use this to treat ITP. Instead for ITP, lalo na kung severe na, no? Bagsak na yung platelets. Ang bibigay natin, dapat platelets. Nakuha nyo, guys? So are we clear with this? Again, remember this question. Next, what corrective action should be taken when RELU causes positive test results? Remember, your RELU is your stacking of RBCs. And what causes the stacking of RBCs? Ang nagkakos ng stacking, high protein levels. Okay, so how do you correct this? How do you remove this? You wash away the proteins. And you do that using your saline replacement technique. So the answer here is saline replacement technique. Okay? Paano kung nag-saline replacement ka tapos nag-persist? Rolo pa rin ba yun? Winash mo na with saline yung RBCs mo. Pag kita mo under the microscope, uy, magkakadikit pa rin yung RBCs. Is this still rolo? The answer is no. O kung hindi po ito rolo, ano to? Kung nagpa-persist after washing. Ayun, very good. This is agglutination. No, kung nag-persist siya after washing, hindi yan relu. That's actually agglutination. Okay, very good. All right. Okay. Next. Ayan. Patient with joint swelling and pain tested negative for your rheumatoid factor. Remember, rheumatoid factor is tested in rheumatoid arthritis. Okay. What other tests would help establish a diagnosis of RA? Okay, so the other antibody we can use would be your anti-CCP or anti-cyclic citrullinated peptide antibody. Yung anti-CCP ninyo, mas mataas ang sensitivity for rheumatoid arthritis. Okay, kaya mas recommended na siya over testing for rheumatoid factor. Okay, so please remember anti-CCP. Anti-CCP is used to diagnose rheumatoid arthritis. Okay, makita nyo to sa Stevens. Okay. Alright, next, which of the following is the primary indication for transfusion of packed RBCs? Maraming sumagot ng massive blood loss. Guys, ang massive blood loss po, okay, we can treat this with whole blood. Alright? Or you can treat this with a mixture of your plasma, RBCs, and platelets. Okay? Yung transfusion ng packed RBC, ang primary indication niya, packed RBC alone, ang pinaka-indication nito is increasing oxygen carrying capacity for whatever reason. Like for example, anemia. Okay? So if the patient has severe anemia, you can give packed RBC. Anong purpose nun or anong indication nun? To increase oxygen carrying capacity. Okay? Yung massive blood loss, most of the time, that is associated with transfusion of whole blood. No? So halimbawa, yung patient mo na aksidente, dinala sa ER, profusely bleeding. So wala ka ng time to separate packed RBCs. So what do you give? You give the whole blood. Okay? So doon usually pumapasok si whole blood sa massive blood loss. Okay, last subject na tayo guys. Are we learning so far? Na-excite na ba kayo sa boards? Kaya ba? Kung mag-board exam kayo today, guys, kakayanin nyo ba? Kung ganito yung mga tanong. Kaya, di ba? Medyo kaya naman. Ayan. Alright. So HTML tayo. So the actual concentration of formaldehyde in 10% formalin is, the answer here is 4%. Bakit 4%? Okay, remember, for you to prepare quote-unquote 10% formalin, okay, what you do is you add 1 part of your stock solution. Yung stock solution nyo, this is 37 to 40% formaldehyde. And then you add 9 parts distilled water. Okay? So yung stock solution nyo, which is 37 to 40% formaldehyde, or let's just say 40% formaldehyde, idadilute nyo ng 1:10. Okay? So pag dinilute mo ng 1:10 ng 40%, magiging ilan na lang yun, guys? Magiging 4% na lang siya. So in actuality, 10% formalin is 4% formaldehyde. Nakuha nyo, guys? So this is how you prepare your 10% formalin. 1 part stock solution, 9 parts distilled water. Natanong na rin before yung concentration ng stock solution nyo. So ang stock solution nyo, 37 to 40%. Okay? So please remember that. Ito marami nagkamali last board exam. Okay? The PRC is a 3-man commission attached to. Okay, maraming sumagot ng Office of the President. No? Tulad ninyo, guys, marami ring sumagot ng Office of the President. Okay, I cannot blame you kasi in your PRC modernization law, okay, originally the PRC was attached to the Office of the President. Originally. Okay, doon sa PRC modernization. However, may lumabas na, ayan, executive order. So this is executive order number 565-A. Okay, this was last 2006. And eventually, yung PRC po, inattach nila kay DOLE. So the answer here is actually your DOLE. Okay? Nakuha? Hindi na po siya Office of the President. Okay, it is now attached to your DOLE. Maraming sumagot talaga dito ng Office of the President. Hindi naman natin sila ma-blame kasi if you remember RA 5527, 'di ba ang nagde-delegate or ang nag-a-appoint ng mga board members nyo, Office of the President. 'Di ba? So you might think na attached pa ang PRC to the Office of the President. No, pero hindi na po. It is now attached to your DOLE. Okay? Huwag kakalimutan, baka lumabas ulit. Okay? O next, ito guys, very obvious naman yung sagot. Which of the following is not a continuing education activity? So ang sagot po dito is watching of vlog. Okay? Watching of vlogs. Yung mga lectures nyo, short courses, scientific conferences, you can actually apply this for CPD units. Pero hindi ka pwedeng pumunta sa PRC tapos i-apply mo yung vlog as your unit. Okay, baka tawanan ka lang dun. Alright? Okay, next, which of the following is the most widely used fixative electron microscopy? Ito guys, tinanong last boards, tinanong din sa last board exam. So medyo favorite question po ito. So the answer here is your glutaraldehyde. Okay? Now aside from glutaraldehyde, para formaldehyde and osmium tetroxide may also be used in electron microscopy. Pwede rin silang gamitin. Pero kung tinanong kayo ano yung most widely used, the answer here is glutaraldehyde. Okay? Ang mnemonics po natin dito is POGE. Ang mnemonics po dito, POGE. Okay? POG. Para formaldehyde, osmium tetroxide, glutaraldehyde. Tapos lagyan nyo na lang ng E, no, para malala yung electron microscopy. Okay? So again, glutaraldehyde po ang most widely used in electron microscopy. Glutaraldehyde. Alright. Last question na tayo guys. Which of the following causes the characteristic foul smell produced by cadavers? Ito marami na naman nag-overthink. Okay? Ginamit na yung term na cadavers. Okay? So ano yung sagot dito? This is your cadaverine. Okay? Cadaverine causes the foul smell, no, produced by cadavers. Cadaverine is an organic compound. Okay? It is classified as a diamine. It is a colorless liquid with an unpleasant odor. Okay? And it is associated with the putrefaction of animal tissue as well as of course your cadavers. Kaya tinawag na cadaverine. Diba? Kasi maamoy mo to sa mga cadavers. Okay? So ilan nakatama nito? 50% naman. Got this right.